These are the Netcare Medical Scheme's golden rules. Firstly, please familiarize yourself with the rules. Make sure that you understand your rights and responsibilities. Obtain pre-authorization where necessary, even for follow-up visits. And remember, an authorization doesn't guarantee full settlement. Always make use of designated service providers and, if possible, negotiate better rates with them. Make sure that you get screened for any health matters. If you have chronic conditions, please inquire about our treatment plans. Please check your monthly member statement. If you are in doubt about anything, get in touch with our client contact center. To view the 2018 scheme rules, benefits, contributions and administrative forms, log on to www.netcaremedicalscheme.co.za. To search for cover you will get from a specific provider, log on to the Maps tool through the Doctor Visits tab. Register on the site to review your statements, claims details, savings balance and any other personal information. Unless otherwise stated, all limits are per beneficiary per annum. Hearing aids are limited to 16,870 Rand, including repairs and maintenance. Other appliances are limited to 3,540 Rand per annum. Prostheses are limited to 73,070 Rand a year with additional sublimits. Sublimits will not apply if you make use of a preferred provider. Please discuss your prosthesis options with your treating physician. Basic radiology and dentistry limits increased by 5% and an annual family limit applies. Specialized radiology is unlimited but may have a co-payment out of hospital except for PMBs. While 9 specialist consultations are covered per beneficiary per annum. Out-of-hospital pathology is limited to 3,150 Rand per beneficiary per annum. The chronic disease list conditions have no limits, while depression as a non-chronic disease list condition has a limit of 2,430 per beneficiary per annum. The Medical Schemes Act makes provision for late joiner penalties for those who wait until they are older to join and are likely to need more cover. We will not impose a late joiner penalty to the main member, irrespective if they join within 30 days or not. Late joiner penalties will also not be imposed to the spouse, partner or adult child of the main member if they join with the main member within 30 days from starting his or her employment. This does not apply to special dependents such as parents. Other than the concessions just mentioned, late joiner penalties will apply to all new applicants over the age of 35, including a spouse, partner or adult child that has been added at a later date. The late joiner penalty will be imposed on all special dependents aged 35 and over. Dependents will be penalized in age groups for the number of years that they have not been on a medical scheme after the age of 21. All benefits and limits are subject to managed care rules and protocols. Non-emergency hospital admissions outside of DSPs are charged a 25% co-payment for the whole event. Hospital procedures are paid at 100% of the Netcare Medical Scheme tariff. Unless it is an emergency, procedures in the emergency department will be paid from savings. When using a non-designated service provider for a colonoscopy or gastroscopy, a 500 Rand co-payment will apply. A co-payment of 500 Rand will apply to out-of-hospital MRI and CT scans as well as bone densitometry scans for members under the age of 50. No co-payment will apply if it is a prescribed minimum benefit. Pre-authorization is required for IVP, tomography, contrast studies, MRI, bone densitometry, CT and PET scans and mammograms. And failure to pre-authorize any of the 9 specialist visits, including follow-up visits, will result in payment from savings. To avoid co-payments, it is recommended to use preferred providers. Specialist follow-up visits must be pre-authorized. The specialist benefit will pay for one optometry consultation a year without pre-authorization. The risk benefit will pay for one flu vaccination per member per annum if it is obtained from a designated service provider pharmacy. You will have to apply and meet the chronic benefit entry criteria for your condition in order to be registered on the chronic illness benefit. Theatre and anaesthetist costs for in-hospital dentistry is paid from the unlimited hospital benefit for children under the age of 8 years. The surgeon cost will be paid from the annual family dentistry limit. Pre-authorization is required for in-hospital treatment and services. All costs related to in-hospital dentistry for member over the age of 8 years is paid from the annual family dentistry limit and not the unlimited hospital benefit. Pre-authorization is required for in-hospital treatment and services. All in- and out-of-hospital dentistry is subject to dental managed care protocols. Pre-authorization is required for prosthesis and appliances. Pre-authorization is only a clinical confirmation and does not guarantee payment. This benefit ensures that members with advanced stages of cancer have access to comprehensive palliative care. The compassionate care benefit was designed for members who require palliative care in the comfort of their own home or in a hospice-type facility. The Diabetes Care Program is based on clinical and lifestyle guidelines and has been designed to support patients in the management of diabetes. The program gives members and specific contracted GPs, referred to as Premier Plus GPs, access to various tools to monitor and manage your condition. You and your GP can track progress on a personalized dashboard displaying your unique diabetes management score. Members with diabetes who have registered on the chronic illness benefit will be eligible to enroll on the Diabetes Care Program, but you must make use of a Premier Plus GP, so please check if your GP is listed. Child contribution rates apply up to the age of 21, while full and part-time students with valid registration documents enjoy child contribution rates until the age of 25. Proof of registration must be submitted annually to avoid adult rates being charged. When a child dependent who is still studying turns 25, they will be regarded as an adult dependent. If they are still financially dependent on the main member, proof must be submitted. Because HR does not inform the scheme of any changes made to personal and contact details, any changes must be submitted directly to the scheme. The company subsidy will be communicated to members via their HR offices. This table shows the annual contribution rates that will come into effect on the 1st of March 2018. Contribution increases have been kept to a minimum, taking into account the claims ratio and the scheme's solvency rate. Netcare medical scheme's rates are still very competitive given the benefits enjoyed by its members. All contact details are available on the scheme's website as well as the member brochure and the pocket guide. To prevent a delayed response, kindly utilize the correct contact details to direct your query. Netcare Medical Scheme for employees of Netcare. You're in safe hands.